Hi, I'm Dr. Tom. I hope you're all healthy and safe as we've been broadcasting on KSRO Ask the Expert every Thursday from my home base right here in my home studio here, as I'm also shelter in place trying to be a good citizen. All right, so again, wishing you all health and safety. Today we had some problems. We're actually doing a Facebook live stream of our show, and we had some problems with it getting posted. So we're gonna kind of reenact the show for you now. Here, I'm gonna put it on YouTube, and YouTube's great. We can keep on going back to it and put it in our files. So welcome to our show on YouTube, Ask the Expert, for again, week 3 shelter in place for us here in Sonoma County. And again, wishing our best to everyone, but in particular to our friends and family in our communities of Sonoma County, Napa County, and Maui County. So today, as we were putting the show together, and our host, Robin Berardini, had asked me, what would you like to talk about? Kind of had the epiphany in the morning. I was sort of getting up, and most of the time I kind of get up, I get some exercise going, shower up, I get dressed up. You can see I have my Aloha shirt on today. I don't have my suit and tie on today because we're obviously shelter in place. And then I carry on with doing as much work as I can. But I've got a little bit of ADD. I'm a social person. I want to be out there in the world. I want to hug people. I want to embrace people. And it's been difficult, to say the least, being shelter in place. And so our patience is kind of getting strained from time to time. So I know when the patients come in to see me in the office and see our great injection staff, our nurses and laser nurses, they're going to say to me, Dr. Tom, I know you always like to look at maybe options that are long-term, going to build up structurally, foundation. Those are words you use all the time. But you know what? I'm so tired of waiting. I've been waiting forever for these weeks and weeks and months of being shelter in place. I want something now, and I want to get immediate gratification, and I just want to feel better about myself. I want to feel better about the way that I look, and I know that's going to be how a lot of people feel. So today, that's what we're going to talk about. We're going to jump into the future as to what our conversations may be and what we're going to recommend for you. So, number one, I'm going to put my hands over my eyes. I don't even have to look at you. If this were in the summertime and people are getting ready in our past normal lives, they begin getting ready for their high school reunions, and they'd say, Dr. Tom, what should I do? And I could do this. They say, I don't even need to look at you. And what I'm going to recommend is Botox or Dysport or some of the newer neuromodulators, which we can talk about later. But Botox or Dysport, what am I talking about? Well, we know they're neuromodulators, and they're going to help to soften muscle movement. So the area that we're going to treat is right in the frown area, okay? So as most of us, we carry our troubles, our concern, and our worries right here, and we're frowning, okay? And so that can kind of give the wrong impression to people as they meet with you socially. It may be a little off-putting. Oh, is that person angry at me? Or is that patient tired, or person tired, or is that person depressed, okay? So by softening this frown area, we can actually help to make you look more appealing, if you will, more open to conversation. All right. It's interesting. They did a study, a social study, where they took clinically on an outpatient basis some depressed patients, and half of them, they did nothing for them. The other half, all they did was give them Botox, sent them out into the world because they were outpatients, and then they brought them back in and they studied them. And they found that the people who had Botox seemed to be a little less depressed clinically. Now, why? Does the injection itself relieve us of depression? No. We believe it's what we call the mirror phenomena. So the mirror phenomena is going to be that when someone smiles at you, what do? You smile back at them, right? So we get that reflection. So if we soften that frown, our eyes look a little more open, we look a little more approachable, we're going to get that feedback, that mirror phenomena from those around us. So that helped to relieve, to a certain degree, some of the depression that those test study patients had. All right, so Botox right in there, no brainer, okay? Going to kick in. It's not going to be immediate gratification, but it's going to kick in about 3 to 5 days. Now, Dysport, by the way, maybe it kicks in an extra day early. All right, longevity-wise, I think they both last just as long. All right, as each other. Now, Another area that we can do to kind of open up our eyes, because we're kind of been tired and we've been cooped in, shelter in place, is the crow's feet area. So not only will it help to alleviate some of the wrinkling that we see there, but by helping to soften the muscle contraction in that area, we're actually going to get a lift of our eyebrows, and it's going to open up our eyes more. So Botox for the frown, Botox for the smile lines or the crow's feet, that's a no-brainer. Now, as we're interacting with our friends, family out there socially, with our work families and so forth, the community, people are going to first be looking at you eye to eye, and that's how we communicate. But then, after a little bit, what we do is we kind of defocus off of the eyes and we kind of step back a little bit, and we're kind of looking at the whole picture, and we're looking at the skin specifically. All right. So the skin is a marker of how healthy we are. It goes way back to the medieval times when some of the illnesses, especially when they didn't have the kind of medical care and nutrition that we have in today's day and age, was that their diseases got reflected in their skin. That's why acne, whether it's juvenile, adolescent acne, or it's adult acne, why it really hits us so hard, affects our self-esteem, because even though it may be just a little pimple or a little bit of a breakout, we think people are looking at that area and making assessments about it. So that's very deep-seated. So we want your skin to look good. And we're looking now, again, for kind of that immediate bang for the dollar. So, because we want it now. I'm tired of waiting. I've been shelter in place for too long. What can I do? Well, I'm going to recommend that you come in and see our award-winning medical esthetician, Haley Mills, in our office. And what we'll do is we'll set you up for one or two things. We could do a light chemical peel. We don't have to do a deep one, just a light one to help exfoliate the top layer of skin, help to make it brighter, okay? But probably where I would go with actually no downtime, where I would go with most patients would be to recommend a hydrofacial. Okay, so a hydrofacial is probably best described as a like carpet cleaning. So what it is going to be a handpiece that's going to go over the skin, but it's going to be doing a deep cleansing of the skin, taking out all the impurities, the pollution that we've been exposed to. And it also is going to be driving in nutrients into the skin. We also get an exfoliation with that. I can always tell when that patients have had a hydrofacial, and I see them at the front desk at our offices, and they have this glow, and it really looks great. You can just see they're glowing. So for that immediate bang for your dollar, looking good, and at a great price point, I would have you have the hydrofacial for your skin. Now, where do we go from there? And then we're talking about, I want results now. The next thing that I'd like to talk about are fillers, okay? And fillers in particular, hyaluronic gel fillers, although there are other types of fillers as well. But we want something that's going to give you immediate bang for your dollar. Okay, and so we know that fillers can be put in wrinkles, can be put in different areas, but probably the number one area where you're going to see that immediate pick-me-up, and I'm talking not just for the women, but also for the men, is in the lips. Okay, so we know as we tend to get older that we lose volume in our lips. We also know that we first initially communicate eye to eye, then we kind of defocus and we're looking at our skin, and then we kind of focus on the mouth, because that's what we're doing. We're talking to each other. And so we look at the mouth. And once again, looking healthy translates into attractiveness. So we want your lips to look healthy. So one of the things that we would want to do is to try with fillers to make your lips look healthy. Then we can go to those next steps of making them more attractive, if you will, if that's what you're looking for, or sexy. So we can work on those aspects as well. So what I'm going to do is I'm going to come off the screen for a moment, and I'm going to grab a teaching aid, and here we go. So we're just going to look at a very pretty model's lips. And what you'll see is that they look very natural. They're very pretty. You can tell that this is a young person. They look youthful. Why is that? They're plump. They look healthy. They don't look shriveled up like we can see as we get older. All right. We don't see a lot of wrinkles around there either. So this is actually a very pretty mouth. Okay. And that's basically what we're trying to create. So let's go over a little anatomy here. So initially, what I want you to understand is that this is the body of the lower lip, the body of the upper lip, the border between your regular skin and the pink or redness of the skin is called the vermilion border. Okay. I also want you to notice that there's two columns here, right there and right there, called the philtrum, and in between the philtrum is the little cupid's bow. And the cupid's bow is especially noticeable in the young, and it tends to get flattened as we get older. So this is what you see right here is the cupid's bow. The other is that I want you to understand that we have formulas when we assess beauty in the world, and one of them is phi, PHI. But basically, what does that mean? That means that the lower lip naturally should be about 50 to 60% larger than the upper lip. And when we sometimes see somebody who's not had such a good job in terms of their filler, because they look ducky, that's where either the patient requested it, or the physician or the nurse injector decided to try to put more in the upper lip, making it equal to the lower lip, and giving that patient, or putting even more in the upper lip. And that's the big mistake. When you put more in the upper lip, that tends to make you look extremely ducky and not natural. Okay, so again, we want the lower lip to be larger than the upper lip by about 50 to 60%. However, I'm going to put a little note on that. In the world of Instagram, and we tend to see that in the younger demographics, they like more of that pouty look. They like the pouty look. So they are actually coming in and asking for a closer to 1-to-1 ratio. I try to guide them because that's my job as their physician, their doctor, or our nurses as their nurses, nurse injectors, is to guide them so that we can make the upper lip bigger, give them that Instagram look that they're looking for. But what we want to do is we want to not make it bigger than the lower lip or even equal in size. So I try to cheat a little bit less on the upper lip. And so that's something that we'll do. Now, as we get a little bit closer, we have pillows. We call them pillows in the lips, or where we see more volume. And typically, if we look in the midline of the lower lip, just on each side, we have a pillow here and a pillow there. And that's an area that I will actually inject. That's an area that I will actually inject here and here, if I have just a little bit, to give you that sultry pout. Okay, now, these pillows are a little bit smaller in the upper lip, but we have them once again in the midline. If you go to the Cupid's bow and come straight down, we have a pillow here and a pillow there. Okay, and so we'll inject some volume in that area as well with filler, and that will give you, again, a nice little projection of the upper lip. However, we should know that there is a smaller pillow right in the middle there, and you got to be careful with that area. You don't want to overfill it because that will give you that ducky look, that lip overhanging that is too much of a projection. But we can add a little bit into a third pillow in the upper lip right in this area here, and that will give you a nice projection. Okay, so those are the pillows that we would treat. And so again, looking at the vermilion border, it's nice if we can have a nice vermilion border, but we all want this to be proportional so that it looks pretty. So now what I'm going to do is I'm going to come into one of my before and after patients, and so I'm going to come in a little bit closer right in there, okay? And this young lady was so cute. She actually was listening to our radio show and on Facebook Live, which I apologize, we had a problem with publishing it, but she was so gracious to let us use her photos. And she's a very young lady, and I'm trying to remember late 20s, maybe early 30s, but you can even see maybe just a little bit of volume loss here. And I'm going to just make this a little bit bigger there. And as you can see that the skin's a little bit wrinkled, that she has a little bit of volume loss. And although we can see the vermilion border here, it doesn't seem to be quite as distinct. And her philtrum, the columns, they don't seem to be quite as discrete right where they join the vermilion border. So what did we do for this young lady? What I did is I only used one syringe of filler, and I'm going to make this larger and bring this down like this now for you. And so as you look at this here, what you can see is that I added volume in the two cushions areas there, and then I added a little bit more in the lower lip. Okay. We also have to know, what does the patient want? She's a beautiful young Latina gal. Culturally, she wanted a more of a pout, definitely a sultry pout. So we added a little bit more volume in the lower lip. Then what we did is we added a little bit more in the two cushions of the upper lip, and just a little bit more to give her projection. All right. So if we take a look at this, and I'm going to squeeze this down a little bit here, and you can see that there is definitely an improvement in the texture of the skin of the lip. So as I bring it in a little bit closer, I'm sorry if there's any reflection, I'm filming this from home, but I think you can see that there is absolutely an improvement in the texture of the skin. So now, what I also want to show is that I used a stenting technique where not just putting in a dollop here, here, and here, but I would, coming from the vermilion border down, I placed some stenting or vertical filler in the upper lip, which gives her more of a lift without making it look like a sausage. And I really like this technique. And so what we did was, again, put some stenting of filler this way. And again, we only used 1 syringe of filler. We also added just a little bit in her vermilion border, and you can see how her philtrum is now connecting to her vermilion border where she lost that definition. And you can see she has nice definition there. So when you look at these lips, you can just tell that the upper lips, the after photo, has a much healthier look. And so healthy, once again, then becomes a moniker, if you will, of attractiveness and also of looking sexy, youthfulness, all of those things that people want. So that's where I would go with filler after you've been in shelter in place, so that we can help you to look better, feel better about yourself immediately. That's immediate bang for your dollar. Now, if we move on from there and we say that we want some more filler, then what I'm going to recommend is putting filler in what I call the money spot. So if I tell you to just touch your cheeks and you just say, with your 2 index fingers, touch your cheek. Most people do this. They kind of do it right there, okay? And I call this area right here and this area right here, I call that the money spot. By adding some volume in this area here, we can help to lift the cheeks up a little bit. We can actually soften the areas under the eye, okay? And so we put a little bit right in this area here. Now, we just don't want to give you a big ball right there, but what we'll do then is actually then layer some filler right in this area here, which tends to lift up the face. So that's what I would recommend as terms of the first steps of coming out of shelter in place and wanting to do something for yourself. So let's just quickly summarize. Number 1, without even looking at you, Botox, frown, crow's feet. Let's get that skin glowing, hydrofacial, or maybe a light chemical peel. Then lastly, filler. Number 1 spot, the lips. Lower lip a little bit bigger to give you that sultry pout. And then to give you a more youthful look, especially for maybe our older patients like me, our aging baby boomers, volume in the cheeks moving out along what we call the zygomatic arch, technically and anatomically, which will give you a more natural lift of the face. So that's it. I hope that everybody during this very difficult time of the pandemic, I hope that you stay healthy, stay safe, and nowadays, stay sane. Thank you very much.